So our last presentation in this session is on community engagement, and the speaker is Dr. Schenita Randolph, and her title is Principles of Community Engagement. Schenita is an assistant professor in the Duke University School of Nursing and associate director of community engagement at the Duke CTSI.
Okay, thank you. Good afternoon. No, good morning still. Rushing the day away. So again, my name is Dr. Randolph, and I am an assistant professor in the School of Nursing here at Duke. As of July 1st, took on the associate director role for the CTSI Community Engagement, and currently co-director of Duke Center for Reach Equity, as we call it, Research to Advance Healthcare Equity. So I'm very excited in the 15 minutes to speak with you about principles of community engagement. And thank you to the last three presentations. I think the last one was definitely sort of a good exemplar of some of the community engagement principles that we'll go over today. And the prior ones, as we look at clinical trials research, and ways to facilitate effective community engagement in all aspects of clinical trials research is important as well. And so I will not have a lot of time to dive into some of that, but there are some really good recommendations that was set forth by the National Institute of Allergy and Infectious Disease of the NIH that sort of gives some recommendations for community engagement in HIV and AIDS and how to be effective in making sure that community engagement is in all aspects of clinical trials research as well. So my objectives for this presentation, probably the first 10 minutes I will look at some of the rationale for community engagement, talk about the 9 principles of community engagement, provide a couple of exemplars based on my own research that focuses on addressing HIV prevention among African American men, women, and children, really looking at health disparities in the Black community specifically, and 2 projects that pilot funding to inform some other projects. So I'll give some exemplars of that as well. And then finally, in the last 5 minutes, I will give you a little bit of information about CTSI. The director of CTSI will be the keynote speaker later on this afternoon. But from the Community Engagement Core, which we call ourselves CERI, Ask CERI, which is Community Engagement Research Initiative, we have a couple of programs that as we focus on community engagement as Duke as a whole, that you may be interested in. And so I'll share real briefly with those. And my timekeeper is, right, okay, keep my eyes on you. Okay. So as we look at community engagement, and the first objective is, what's the rationale for it? This is a nice definition by the CDC that says it is the process of working collaboratively with and through groups of people, and this can be based on geographic areas, special interests, to address similar concerns or that are affecting those who are impacted through that partnership. It is a powerful vehicle to bring about environmental and behavioral changes that will improve the health of the community. The key thing is that it does involve partnerships, coalitions that will help to mobilize resources and influence change. When I think about the rationale for community engagement, I always say that you have to have a why. What is your why? Because community engagement, as we will see and you'll hear throughout towards the end, true community engagement takes time. And so there really has to be a why. And for me, in my work, my why, things that I had to consider are, I really want to hear the voices of the people who my work is influencing, so that I can be well informed on developing culturally and socially relevant interventions that will address HIV prevention among Black women or among African American adolescents, which are some of my focus populations. So for me, I really have to ask the why. The rationale behind hearing around doing community engagement is that it does help you to understand some of the life experiences, some of the barriers and the challenges. We all do a lot of good work. And as a nurse scientist myself, for me, it is important to make sure that as I am being engaged in my research, that I am being effective, that I'm being efficient, and that the interventions that I'm developing will be sustainable in the communities in which I am working with. Also, the rationale behind it and the why for me is to make sure that I am partnering with the community and that I'm not taking from the community, but I'm also giving something back to the community. So when we look at community engagement, there is a continuum, and this chart is from the International, modified from the International Association of Public Participation. And here you'll see that community engagement has a continuum. It can go from having a community advisory board, or going out into the community, some level of community engagement or involvement, where you have people that are sitting on your research projects to provide input from a stakeholder perspective. They can act as consultants. And then as we go down the continuum, we're really talking about their being involved in that. And what that looks like is that the communication flows both ways, that I'm not just sharing information about my project, but they are in return giving me information, and we both have a shared interest. And it can also go as far as shared leadership, which really gets on your end of your participatory research, where there's a strong bi-directional relationship. The final decision making is at the community level. There have been formed strong structures around this, and again, there's shared decision making around the outcomes. So as I talk about these 9 principles, I'm really going to talk about them in three different segments. The first few are going to give an idea of, before starting in community engagement, what is important to do. The second is going to look at what's necessary for community engagement to occur. And then lastly, the principles are in a category of what do we need to consider for engagement to be successful and for it to be sustainable. So the first 2 principles, before starting a community engagement effort, and let me pause. Anyone in the room who actually applies community engagement approaches to your work? Just a few. Well, I'm in the right place. Okay. Just wanted to get a tap on the audience. So before starting a community engagement effort, there are a couple of things. Be clear about the purpose, what the goals are. Have clarity about the population in which will be engaged, and become knowledgeable about the community. And that knowledge means, what are the norms of the community, the history, the experience? What is the experience of engagement efforts with the community? And so really taking a tap on these things is really, really important. So just an example of that, an exemplar on how that's played out. Recently received funding through CFAR through an administrative supplement to look at the feasibility and acceptability of a salon-based intervention to promote PrEP awareness and uptake among Black women living in the southeastern United States. And so through this project, this feasibility project, I'm going to be looking at some of the perceptions of salon owners, of stylists, determining social networks of Black women, perceptions of Black women on receiving PrEP, and also hearing the perceptions of Black women about medical mistrust in the context of PrEP uptake. So when we look at the first 2 principles of being clear about the purpose, being clear about the goal, knowing who it is that you're speaking with, there are some steps that I've had to take in this process, and these are informal meetings with salon owners. The literature does support that salons and barbershops is not a new concept. It has been effective in the Black community in promoting health around cancer. HIV has been more so with barbershops and men. So I've had informal meetings with salon owners to really sit down and to explore with them, to pitch to them, you know, these are some of the things that we're looking at, and really helping them to see the need in the particular communities in which they work, live, and play, you know, their own communities. and asking them, have you been a part of research in the past, and how has that gone for you? So these informal conversations help to really understand how to approach the community, and also understanding the dialogue to see what is the big picture, what is the common goal in this. So those things are very important. And also to understand their why. If they were to participate in this, why? What is significant for you? And just hearing the stories of, well, on a daily basis, I hear of conversations of women sit in my chair about health anyway. And I understand that in our community that XYZ is happening. I just heard on the news. And so it really gives dialogue to understand who your community is. In one conversation I had with a salon owner, she stated to me, I was a part of a research study, but I don't know if I'll ever do that again because I dedicated my time and I never know, I have no idea what the results were of that. And so those informal conversations help me know how I need to move forward and to guide that. So coming together for a larger purpose of that. As a result of that, I've also included on this proposal a community consultant who will be a salon owner, who's had over 20 years of experience on that, because there's a shared partnership. And we talk about incentivizing and compensation for our community partners, and that now is becoming real key, and it is important that people are, because they're experts in their own right, just like I'm an expert in my own right. And if we're really sharing in that, they need to be compensated for their time and their expertise in that space. So just an exemplar of that for the first principles, understanding that there's formal and there's informal listening, that we're partners, that they're just not informants, and that I'm building on the existing strengths. And those are some of the key principles, understanding the strength that salons potentially have for Black women. How can I build on those strengths? Principles 3 and 4, for engagement to occur, it is necessary, very necessary, to go to the community. I think it's really easy. I was thinking about, I need to bring my community advisory board together for my program of research. And it's real easy for me to reserve a room in the beautiful School of Nursing and have them come here. But really, when you talk about the principles of community engagement, even in the simple things, that means that I will find a place where it's in the community that's easily accessible for them, that they do not always have to come to me, that I go to the community. And that's just a simple example of how that can easily be done. Empower the community. Make sure that we're building trusting relationships, that we get from the informal and formal leadership feedback, that we have representation on the leadership team. I'm going to talk about another project in just a moment, but it is a foundation grant that I have received in which I have 2 barbers who are actually a part of my research team. And so there's representation on the leadership team. There's shared decision-making, there's shared resources. And so empowering the community and going to the community is essential. The exemplar in that is, again, I'm in the process of developing a mobile app that will help fathers to be able to guide and educate their adolescent sons, particularly around HIV prevention. Well, where did I get this from? From 2 prior pilot studies with African American fathers and with barbers who really informed and gave me good information that said this is the way to go. So now in the process of developing that mobile app, and we'll move forward to do some testing around that and the outcomes of that. I'm being very intentional not to go a lot into the actual research, so I'm available if you have questions about it. But this cutting edge program will provide fathers with the necessary tools to educate their adolescents. Again, this came from working in doing the pilot study, focus groups, interviews with African American fathers, recruiting them from local barbershops who really informed the next steps of program development. Also, having gatekeepers is important. On my research team for these two projects, I had a research study coordinator who was an African-American male. He was also a father. His professional work was a social worker. He was a barbershop customer, has been all of his life, so he understood the barbershop culture. He went into the community. He was a part of the community. So having gatekeepers is essential when we're talking about doing community engagement as well. For engagement to succeed, we have to recognize that it's necessary to create change and to improve health. The impact that it can have by partnering with the community. And in my case, I'm partnering with individuals. There are other research studies that engage community engagement that will partner with community-based organizations who already have sort of a structure and an outcome and a mission. So that would be important. Recognizing and respecting the diversity of communities is essential as well. So, you know, community engagement processes and research is not confined to minority participation. However, community engaged research, what we see a lot is that a lot of community engagement programs and research often involve people from universities who are working with community groups that are labeled as low income or at risk. And so that is what we see, but let's be clear that it is not in the confinement of minority participation for research. The overall goal is to hear the voices of who the research is going to impact and how it will inform the work. But considering that that is the case, it is important that we examine how society produces inequalities, how it can produce discrimination, how it can produce racism, and all of this is essential to understand that so that we understand that it is a process of the community engagement research perspective and that we have understanding and acknowledgement of those things. And so that we understand the insiders, that we respect the diversity of the community, and that we recognize that all of those things could exist as we go into communities. Identify and mobilize community assets and strengths, develop capacity and resources, be prepared to release control of actions, be flexible, and understand that community engagement approaches and research is a long-term commitment, but it is definitely worth the while if it responds to your why. There are some major challenges. It is time sensitive. It really is. Balancing research with action, alignment of the community priorities for funding, making sure that it's in alignment with the funding agencies, organizational structures, equity and partnerships. So there are a lot of challenges to community engagement principles and approaches. And some of the lessons that I have learned, again, and I'll say it, is to understand the why of what it is that we're doing, but also understand that that partnering with another like-minded organization or individuals will help with the effectiveness, the efficiency, as well as the sustainability of the work. Okay, moving on to the last piece really quick is Ask Siri. So I do want to just share a couple of things about some of the programs that are happening with the Community Engagement Corps with the Duke CTSI, real briefly. Our overall aim is that we are providing programs and tools to make sure that the community engaged research spurs collaboration and innovation. So that is one of our aims here with the Duke CTSI. These services are available to all of you. So community engaged consultation services, this facilitates the academic and the research community partnerships. So there is an opportunity for you to get a consultation about your project or your program. The community engagement e-library, and all of this can be found on Duke CTSI website. where this provides training. It also provides other evidence-based materials for you and tools that your research team or your community partners may be interested in seeing. Spark Studios, this is an innovation incubator, where if you have, you want to work with an interdisciplinary team, maybe on your work, but you want to think of something innovative. It just brings together researchers, community partners to really just spark an idea and move forward with that in terms of funding. We also have the Population Health Improvement Palette Awards, and these grants help to spark and provide collaborative and innovative partnerships around community engagement. We want to also look at local, regional, and national capacity. FACE is a new program that is coming up. Really excited about this one, in which we will empower community members around Research 101. They will become community navigators for research, and they will be compensated for their work in doing that. AME Zion Duke Health Partnership is a partnership between Yale and Duke, and AME Zion is also a group of clergy who have the purpose of making sure that we are engaging African Americans into clinical research. And so these clergy have been trained in research and have the purpose of making sure that we can regain trust with the African American community around clinical research. They also are available to provide input into clinical research development or any questions about tools as well. And again, I'm going through these really fast because you stood up, my time is about over. But all of this is on the Duke CTSI webpage. Bidirectional trainings, we have CBO 101, which is community-based organization, and we also have community engagement research. So these are some of the trainings that we also provide to the Duke community and their partners. And we're also looking at ways to help disseminate the work that we do. It is so important that the community understands what is happening clinically, social, behavioral, around HIV to keep them engaged, because whenever it hits them from a clinical perspective and it's time to give them PrEP, you know, what happened throughout the process of that would help to build that gap of trust to keep them engaged in the conversations. So that is my time. Thank you. I love this quote: community is much more than belonging to something. It's about doing something together that makes belonging matter. So thank you for your time. And again, if you have any questions, feel free to reach out to any of the leadership for the Duke CTSI Community Engagement Corps. Thank you.
Thank you, Schenita.